Hey guys, my name is Danielle. I'm a second semester HBU nursing student. The following video that you're about to see is your medication administration checkoff. Sophia is going to be in the role of our nurse, and she's going to run you through everything that you need to do and what to expect, as well as the paperwork you'll be filling out. So sit back and enjoy the video.
Hi.
Hello, how are you today?
I'm good. How are you?
I'm doing well, thank you for asking. Alright, so here's your scenario for your medication checkoff.
Thank you. So I'm gonna match up my patient with the scenario that I have. So in the paper I can see my patient's vitals and the medication orders that the doctor has prescribed. So now I'm gonna go to the Pyxis. Alright, next up I have my orders, so I'm gonna start looking for heparin. So heparin is given subcutaneously. This is heparin, 10,000 units per milliliter, and the order is for 5,000 units sub-Q, so I know I'm gonna need a syringe for that. And it expires 2020, so we can use that. Now for my PO medications, I'm gonna use a little cup. Next up, I will look for Lipitor. So Lipitor, 10 milligrams PO. Then we have Colace, 100 milligrams. So Colace here, it says 50 milligrams, so I know I'm gonna have to use 2 of those. So since my patient is in moderate pain, I'm gonna go with acetaminophen. So it says, the order says 500 milligrams and the bottle says 500 milligrams, so I'm gonna use 1. So once you open it, you're gonna pour out without touching and pour it into your cup. So now I have all my medications complete. Next up, I'm gonna draw up the heparin. So you have to grab a syringe that's going to fit what you're going to do. So it says 10,000 units per milliliter, and I know I only have 5,000 units, so that means I'm going to use 0.5 milliliters. So I'm going to grab a sterile alcohol pad, open it, clean the top, draw 0.5 of air, and then insert the air into the vial and take out 0.5 milliliters. Okay. So next thing you want to do is you come into the patient's room, you make sure that your hands have been washed, and you want to introduce yourself to the patient. So, hi, Ms. Smith. My name is Sophia. I will be your student nurse today, and I am going to be distributing your medication. So then you want to make sure that you have the right patient. So I would scan his wristband and also ask for a full name and date of birth or medical record number. Next, I would position the patient up, make sure that they have water because the medications that we're giving are PO, so he needs to be able to swallow them. So the first thing I want to do is go through the 5 rights. So I do have the right patient, then I want to make sure I have the right drug, Lipitor and Lipitor, right dose, 10 milligrams, 10 milligrams. Right route, it is a pill, so it is PO. Right time, it's given at 9 a.m. daily, and he is not allergic to it. He is allergic to digoxin, so that does not matter here. And the expiration date is 2015, but that's okay in this scenario. So for Lipitor, Mr. Smith, this is your medication to help lower your cholesterol. So this is Colace, and I do have the right patient again. So Colace and Colace, the order is for 100 milligram, and each Colace is 50 milligrams, so I know I'm going to need 2 of those. It's given PO, and it's in pill forms, and it's every morning. Expiration date is 2018, but again, it's okay in this scenario. So Mr. Smith, this is your Colace. This is going to help you soften your stool. You may experience some cramping, but you shouldn't worry about that. Next up, we have the acetaminophen. The order was for 500 milligrams, and we checked that in the Pyxis. It is PO, so it is in pill form, and it's given every 4 hours. So I would check in the MAR when was the last time that he was given acetaminophen and make sure that it's been at least 4 hours. And this, Mr. Smith, is going to be to help with your pain. Lastly, we have heparin sodium. Heparin is 5,000 units, and we had drawn up 0.5 units as per the bottle, and it's given sub-Q, so I'm going to inject this. This is to help thin out your blood, and you should expect a little bit of bruising around the area of injection, And if you have any abnormal bleeding or hemorrhaging, please let me know. Since it is sub-Q, I'm going to give it in the fatty part of the stomach. After educating my patient, I would go ahead and give the injection. So, Mr. Smith, I'm going to give you your injection in your stomach. I would pinch up a little bit and then just insert. So after giving the injection, before opening up the rest of my pills, I would ask my patient if he's able to swallow or wants to swallow them one at a time or all at the same time. So if he says one at a time, and give him water. If he says all of them at once, go ahead and open all of it and then give him his water. After administering medication, I would ask the patient if there's anything else he needs from me. Then I would make sure that the call light is within reach, that the bed is locked. If I raise the bed up, I would make sure to lower it back down and make sure that the side rails are upped. I would also tell the patient that I will be back in 30 minutes to check on his condition since I gave him a sub-Q injection. So after giving meds and leaving the patient in his room, I'm going to go ahead and document the medications that I gave. So I have my document sheet and I see I gave heparin, so it is 9 a.m. So I'm going to initial next to heparin next to 9 a.m. And I would go ahead and do this with all the rest of the medications that I gave.
During the medication administration documentation, you document the medication that is given as needed. For example, in the video, acetaminophen was given to help reduce pain levels. You date it, write the time that the medication was given, the name of the medication, the reason for giving the medication, the result of giving the medication, and you initial. Next, you document the medication that was not given. Again, you date it, write the time, the medication name, the reason the medication was not given. For example, the patient refused to take the medication, or a patient may have had an elevated blood pressure or a low blood pressure reading. Lastly, you initial it. Hey guys, it's me again. So just a few last reminders before you do your medication administration checkup. Make sure you are in your scrub attire, you're a professional, you show up 30 to 45 minutes prior to your sign-off time. Make sure you bring the papers that your professor told you to bring. I know nerves, they're going to be a thing and you're going to be nervous, but breathe, I believe in you, and you are going to do great. I hope this video helps, and we'll see you next time. Bye!